Hey, what's going on? I'm Dr. Brown. Thanks for tuning in to this free webinar on neck pain. So we'll be breaking down some common causes of neck pain, some things that you can do to prevent neck pain, as well as some things we can do in our office to help with neck pain. So when talking about neck pain, you probably think about these common things that we see in our office. So disc degeneration, degenerative joint disease, disc herniations, and headaches. Now, those are all pretty common complaints with neck pain. One thing I'd like to think about when thinking about these problems, though, is what causes them. So what's the underlying cause of all these things? And I think they can all come down to one factor, and that problem is that they're exceeding the capacity. So they're exceeding the body's capacity to heal, essentially. So with disc degeneration, enough wear and tear over time is going to cause some natural degeneration of the disc, and if you put too much stress on the neck over time, it's going to cause more degeneration, which can lead to problems. Same thing with degenerative joint disease, same thing with disc herniation. It just reaches that point where that disc can no longer hold and it ends up herniating. So how do we eliminate that? A couple things that cause these problems that I like to think about are tension and joint restrictions. So if we think about tension through the neck, you have a host of muscles that connect the neck to the rest of the body. If there's tension in one area, it's going to put more tension in other areas. So if you look at the neck from the side here, it should be kind of a backwards C-shaped curve there, if you can kind of picture that, okay? Fun fact, the average human head weighs about 11 pounds. So I'm going to hold this 10-pound weight here. So if you picture this, I can probably hold that for a long time, okay? Not too bad. If I bring that forward just an inch, that's going to put a lot more stress on those muscles back there. So same concept with the neck, holding the head up. So as that neck comes forward, it puts more tension on those muscles in the back of the neck, which leads to then more pulling down and tension and compression in the neck. So if I hold this like that, I could probably only do it for 10 minutes or so. So that's just a concept I like to think about. So we look at that a lot with the desk workers, people that are on their phone all the time. You might be watching this on your phone looking down, so try to bring your posture up. So like I said, as we exceed that capacity, it causes these problems here. So looking at the neck, we're going to go over some anatomy here. So you have 7 cervical vertebrae. In between the vertebrae come the spinal nerves, which come out. So you have 8 pairs that come out. And these go into the shoulders and arms, and as you see, the 8 pairs. So if we have a problem in some of those spinal nerves, so say we have a problem up here, that can lead to headaches, it can lead to vertigo, it can lead to jaw pain even. That creates tension throughout those areas and can lead to those exceeded capacity problems. If you look at the lower cervical spine, problems there can lead to shoulder problems, some tingling, numbness into the hands, carpal tunnel syndromes, rotator cuff problems, and tension can also create problems with the upper ribs and the upper back. So if you're having a lot of tension through the upper back, a lot of tightness, a lot of those trigger points in the traps, the trapezius muscles in the upper back, those can often be coming from the neck. So that's a pretty simple anatomy for you. Like I said, there's 7 bones that stack on top of each other. In between some of those is a disc, which allows it to bend and move. If you picture a joint restriction, that's when a joint gets stuck and locked up. You've probably felt that before if you turn your neck and you feel kind of one spot that's irritated and a little discomfort. That's usually a joint restriction. So that usually happens, locks up the neck in one segment, so the other segments above and below have to move more, if that makes sense. So it should kind of move flexibly like a big spring. If we welded 2 of those areas together, the areas above and below have to compensate. So that can lead to more problems, more tension, and more exceeded capacity. So what can we do to help with this? So a couple things. This is going to be pretty general. If you have a problem, definitely give us a call. Come in, we can get a more customized plan based on your problem, because this is not a one-size-fits-all thing, but I'll give you a couple stretches that you can do to hopefully help with a little bit of that tension. So one of them that I like to prescribe to patients is the levator stretch. So you have a muscle, comes from the neck, goes into the shoulder, called the levator scapula. So you're going to take your opposite hand, look down about 45 degrees, and pull down, trying to feel a stretch through there. Okay, you can kind of come to the side, get a little bit more of the trapezius and the scalenes as well, but that's a good stretch to do. I'd hold that for about 20 seconds. Shouldn't be any sharp or shooting pain with that. Next thing I would like to recommend is the chin retraction. So you're gonna bring your neck above the shoulder. So you're trying to get your ear above the shoulder here, okay? Kind of make a double chin. This is just a good little exercise to try to do throughout the day to work on your posture. Another one, if you have a band, this is a great way to activate the lower trapezius muscles, which is going to take tension off the upper trapezius muscles. So you will grip the band underhand like so. Try to bring your neck into a neutral position, and then externally rotate the arms. Try to squeeze the shoulder blades down and back together. Okay, this is great, again, for desk workers or anybody with that upper back and neck tension. All right, so hopefully that was helpful. Hope you got some good information. If you have any specific questions, feel free to send me a message or shoot me an email. Feel free to follow my page on Instagram at doc.bbrown and follow me on Facebook at Brown Chiro Swansea. Thanks for watching. We'll probably do some more of these videos in the future, so if you have a topic you want covered, I'd be happy to cover it. Feel free to give my office a call at 618-744-7314, and I'm Dr. Brown. I'm a chiropractor in Swansea, and thanks again for watching.